Allie Torrence is talking with us today. What's your PT superhero backstory, Allie?
Yep. So my name's Allie. As you said, I work in Boston in outpatient private orthopedics. When I was younger, I tore my ACL, which is, I feel like, the classic physical therapy outpatient story, playing soccer. And I tore it twice. So my physical therapist when I was younger in like middle school told me I would be a physical therapist one day. And I laughed at him. And then I ended up pursuing the career, and I'm still in contact with him today. So he also has his OCS. He's a good mentor of mine.
So you gave us a little segue into what we wanted to speak with you about, which was your experience deciding to get your OCS. How was it going through preparing for your OCS? And now that once we'll do a spoiler alert, you got your OCS, correct?
Yep.
So perfect. So we did the spoiler. We've revealed the results. But let's talk about that decision-making process. What sort of factors or what things helped influence your decision to take that OCS exam? How'd you know it was right for you and the right time?
So I went to Massachusetts General Institute of Health Professions for physical therapy school, and a lot of our professors have specializations, and a lot of my mentors when I was doing clinicals all had their specialization. Sometimes it was NCS, sometimes OCS. So I got a broad variety. And I really noticed a difference between those I worked with who had a specialist certification and those who didn't, more just in a sense that I felt like they were able to take patients and think critically and really think about like the next step and think a little bit more further in detail, which is something I always wanted to aspire to do. So
once you decided this is right for me and it's the right time, how'd you go about preparing for it? What resources or study strategies did you find most helpful during your preparation?
Sure. So first, I definitely don't think there's ever going to feel like a right time to take the exam. I took it basically as soon as I knew I was eligible, and it was something in the back of my head that I always wanted to do. And I think when the time came to apply, like I almost did not apply for the exam because I was worried about like, am I ready? Can I do this? And basically, I just thought there's really never going to be a right time. I'm always going to be busier or doing a lot of things. So I basically just decided to go for it. Very happy I did. I used MedBridge, I used the Current Concepts textbook, and I used Physio Field Guide, which all were super helpful. And I think the biggest thing with just being actually like working and having a full-time schedule is making sure you're practical with your time. And so I knew after studying for the MPTE, like realistically, how much can I study in a week or a day, and just mapping out my studying habits then.
That's great advice. Now let's talk about the actual test. Any sections that you found particularly challenging or surprising? You know, you really can't share questions, right, for the next generation because they change. But any sections or ways they were asking questions that, you know, were particularly challenging for you?
I think the hardest part of the exam was definitely like the last two sections because you're tired. And I was tired of, I was really trying to read the question and do like process of elimination. And so you get to this fatigue point. I would say one thing I found out when I was studying for the NPTE is that I would get really caught up in multiple choice questions, like reading the question, getting scared or nervous because I didn't really know the answer, and just automatically picking the answer that was most familiar to me, versus like taking a breath and looking at that answer and actually knowing I know I know what that answer choice means. Does this actually answer the question? And when I thought about it more like that, almost in reverse, I could do a better process of elimination, and that really helped.
So two lessons I think you shared there, which is study like the test is going to be given so that you can study with that endurance factor and build up your endurance. And the second is know yourself, know what traps you might fall into, and make sure you can figure out a way to not fall into those things.
Yep.
All right, let's talk about after the test, because, hey, we mentioned earlier, spoiler alert, you've completed your OCS, so congratulations to you for that.
Yeah.
How has becoming an OCS impacted your career so far? Have you noticed any immediate changes in your clinical practice or professional opportunities since receiving the OCS?
Sure. I would say I noticed a difference like almost right away just studying for the exam. I was really able, because I'm in orthopedics and I knew I wanted to specialize in orthopedics, I was really able to take like what I was studying and learning and apply it to my patients. And I wasn't shy about telling people I was taking the exam. A lot of my patients knew I was going to take it, and they were very encouraging. And I've had a lot of patients tell me, "Oh, you seem like a lot more confident," or "Oh, did you learn this like studying for your exam?" And so I've noticed that almost immediately. And I actually had a patient earlier today. I told her I was doing this for over lunch, and she told me that she's noticed a big difference in like my education to her and implementing like new strategies. And she's very thankful I took the exam.
That's great. I mean, that's who you ultimately took the exam for. It's for yourself, but also for your patients. So that's great that they're giving you some feedback that they noticed some of that.
Yep.
How about advice? You know, what advice maybe would you have given yourself a few months before deciding to take the OCS for someone considering to take that exam and take on that challenge?
Sure. I think I felt pretty young to take the exam because I basically applied as soon as I could take the exam. And I think I almost had imposter syndrome of thinking like, oh, I'm not ready to take this. And really just getting past that and telling yourself like, again, why you're taking it, and you're taking it to help your patients more and just continue to learn. I'm really just glad looking back that I just went for it and signed up for it. And I have a lot of friends and people who are thinking about taking it, and I just tell them, if you're thinking about it, you definitely should do it.
Jump in and then figure out how to do it by calling Allie and getting a plan later.
Yeah.
All right, Allie, first of all, we'll say congratulations again on taking on a challenge as robust as the OCS so early in your career. And thanks so much for sharing your insight for people who are thinking about jumping off that diving board and jumping into their OCS.
You're welcome. Thank you.